I'm a former Major League Baseball physical therapist that helps injured pitchers get back on the mound. And I'm gonna go over today a couple of exercises I will use for rotator cuff strengthening. And this can be used for either part of the rehab process, a lifting program, or from an arm care standpoint. To kind of preface why we're doing a lot of this stuff, we know from a thrower standpoint, you need a robust and strong rotator cuff for a couple different reasons. Having a strong and robust rotator cuff is gonna help keep the shoulder centered in the joint as you go through your entire throwing motion. If you don't have that good centering of that shoulder, what's gonna happen is that shoulder is gonna start, for lack of a better term, bouncing around in the shoulder joint. It could slide backwards, it could slide forwards, or it could slide up. And depending on the direction that you have any type of instability, whether it's one direction or multiple, you're gonna put stress on different structures. So for example, if you give a lot of kind of pushed forward like this anterior instability, you're gonna get a lot of tension on that bicep tendon right on the front. If you get a lot of superior, you're gonna start to decrease that subacromial space. So you can start getting some bursitis issues there, or you can kind of get that cuff tendon to be pinched. Or if you get a lot of posteriorly, you can start potentially getting a little bit of some pinching and what we call internal impingement at the end, essentially when you get into layback. And that's a totally different topic for a different video, but that's why we do a lot of these rotator cuff strengthening exercises. And the nice thing about the TRX is, if say that's all you have, you're on the road, you're traveling, you take a set of these with you, you can get a lot done without having any access to weight. So the first thing we're gonna do, we're just gonna start with really just a 90-90 external rotation hold. So what that's gonna look like is, what you're gonna do, you're gonna bring these up, you're gonna have your pretty much hands out in that 90-90 position here, shoulder blades are engaged. You almost think about kind of somewhat keeping them down and back and more so tucked against your shoulder blade. You're gonna get in that position here, and then you're gonna start walking your feet in until you're at a solid angle, and you're gonna hold that here. Now, as you can see, the deeper you go, the harder it is gonna be. So that's why you wanna start with maybe like a 20 to 30 degree angle, start in this position here, and then very gradually start to increase the incline. You do not want to go so far that you can't hold up in this position. So what I don't want is, I don't want us going deeper, but we're in like this position here and we can't hold up. Typically with that, I'll start guys with like 3 to 4 sets of 20 seconds or so. It gets tough very quickly, and then you can either increase the duration as needed, or you can start to increase the incline and drop the duration because it's gonna be a harder movement. So next what we're gonna do, we'll do essentially a 90-90 face pull. So instead of pre-positioning yourself there, you're gonna start in an incline position here. You're gonna be here, pull yourself up to 90-90, and then come down. Pull up to 90-90, and then come down. You're really just pulling yourself up to that position. We're not totally far into the back. We're keeping everything in a good locked in position, and then we're coming down. The next progression to that is a more of an eccentric 90-90 ER. So this is a lot tougher than the two movements we've done so far. So you're gonna wanna start in a little bit of a less inclined position. So you're gonna be here, and it's gonna be a slow rotated down, come all the way down here, come back up. You're gonna slowly derotate, let it come forward, and then go back up. So that's that eccentric 90-90 ER. So now we've kind of worked that ER position. We're gonna now work into a Y position. We're gonna start in that overhead Y position here, and you're gonna start even less of an incline, to be honest with you. The biggest thing is making sure you're using that scap and that shoulder blade to get back there. You don't want it to be just all shoulder more than anything, okay? So we're back in that position here. You're in a Y, you're not overhead, you're in that Y position here, and we're just holding that. Probably about 3 to 4 sets for about 20 seconds to start. This is gonna be a very tough one to do when it's done correctly. So after that, then we're gonna go into a Y pull. So take a little bit of an angle here, arms are straight, you're pulling into that Y overhead, hands are back in, and then come down. You'll see why I kind of bring the hands back in. So we're going up, and then coming down. So we're trying to take away a lot of eccentric stress here. So it's a lot more just the concentric pulling into the Y. Now the last thing is the eccentric Y. So you're gonna be in this position here, you're gonna pull up, and then it's a slow 1, 2, 3. We're here, pull up, and a slow 1, 2, 3. So those are 6 different TRX exercises that we might use not all at once, but at some point along the rehab continuum or as part of a lifting or arm care program. So I would definitely start with the isometric holds for both of those, then work into the full kind of range pulling into it, and then the eccentric is the last component of that. So you can find a different way to add those in. I wouldn't necessarily do them in a warm-up. I would use them really at first, either an arm care standpoint or as part of your lifting program. So start giving those a try. It's a great way to get some rotator cuff stimulus and some scap work as well. If you have any questions on it, leave a comment below with your question, and subscribe to our channel for more content like this, specifically for baseball athletes.